5 health checkups you should rethink after 70 because some may harm you more than they help. There's a hidden truth most seniors never hear. Every year, millions line up for routine exams, believing they're staying safe. But what if I told you that a surprising number of those tests can quietly push you toward complications, unnecessary procedures, or even long hospital stays? A major medical analysis found that nearly 40% of testing in older adults leads to overtreatment and harm, and most people over 70 don't realize it's happening. One of the tests we lines cover today has even been linked to causing almost as many cancers as it prevents. You won't see that on a billboard, but the science is there. On the surface, more testing sounds like good prevention, but the reality is different. Testing often creates false alarms, extra scans, biopsies, or surgery. Doctors call this the cascade effect. One test leads to another, and another often without improving lifespan or quality of life. And as we get older, the stakes rise: PrEP, sedation, radiation, contrast dyes, hospital stays. Things the body bounces back from at 40 can be dangerous at 75. That's why before every test, it helps to pause and ask one simple but powerful question. If this test finds something, what happens next? If the next step is risky or invasive and the benefit is uncertain, that's a signal to slow down. If this is helpful so far, make sure you subscribe for more science-backed tips on healthy aging. And don't forget you can download your free brain health checklist in the description below. Let's begin with bone density scans. DEXA scans measure bone density, and they can be valuable in some people. But in seniors, they're often overused. As we age, bone density naturally declines. The scan labels many older adults with osteopenia or osteoporosis, even when the actual fracture risk is modest. That label can trigger strong medications, often bisphosphonates. These drugs help in severe cases, but they can also cause problems: reflux, esophageal irritation, rare jaw issues, even unusual fractures. For mild bone loss, the risks sometimes outweigh the benefits. Take Rose, 76. She had no falls, no pain, and walked daily. A routine DEXA labeled her with osteopenia. She was prescribed a bisphosphonate and developed painful reflux within months. Later, she switched to vitamin D, protein-rich foods, and resistance training. Her strength improved, and she stayed fracture-free. When does DEXA make sense? If you have a history of fragility fractures, long-term steroid use, or very high risk, it can help. But for many, the smarter default is to focus on strength, balance, protein, and vitamin D. Studies show lifestyle changes alone can reduce fracture risk by nearly 20%. The bottom line, don't let a scan number push you into lifelong meds if your actual risk is low. Forgetfulness is frightening. The instinct is often, let's order an MRI, but here's the catch. Most MR is in seniors with mild memory complaints show normal age-related changes like white matter spots or shrinkage that aren't dangerous and can't be treated. Once something abnormal shows up, it can cause panic and a cascade of more tests: spinal taps, repeat MRIs, even brain biopsies, none of which improve everyday memory. George, 74. Misplaced keys and forgot names? His doctor ordered an MRI, the scan showed changes, and George panicked. He withdrew from social activities, convinced he was losing his mind. Later, cognitive testing showed his memory was normal for his age. With better sleep and brain exercises, he stabilized and felt like himself again. A better first step is a short cognitive screening test. It's quick, low risk, and far more useful for guiding next steps. MRI should be reserved for new seizures, rapid decline, sudden personality change, head trauma, or stroke symptoms. The bottom line, for mild lapses, start simple. Don't jump to the scanner unless there's a strong reason. Cardiac stress tests are among the most common just-in-case exams in older adults. But here's the problem. In seniors without classic symptoms, false positives can be as high as 40%. That often leads to angiograms, stents, or bypass surgery in patients who don't benefit from them, and each of those procedures carries risk. Raymond, 75, was active and walked daily but felt tired on hills. A stress test suggested narrowing. He was rushed into catheterization, received a stent, and suffered kidney issues from the dye. After a week in the hospital, doctors concluded his fatigue wasn't even cardiac, it was dehydration and mild anemia. Safer first steps include a resting ECG, blood work to check for thyroid or anemia, reviewing medications, hydration, and gradual conditioning. Unless you have chest pain, shortness of breath, or classic warning signs, a stress test may create more danger than benefit. Next, colonoscopy. This one surprises most people. Colonoscopy is a powerful lifesaver earlier in life. But after 70, especially after 75, the math changes. Complications rise sharply: bleeding, perforation, sedation risks, dehydration, delirium. Meanwhile, many polyps in seniors grow so slowly that they'd never cause harm. Dana, 73, had no symptoms and clean colonoscopies in the past. She had another routine one anyway. A tiny polyp was removed, but that night she suffered a perforation, requiring surgery and a 9-day hospital stay. Guidelines now recommend individualized decisions after 70. If you've had repeated negative screenings, you may safely stop. For those who want continued screening, FIT stool testing at home is non-invasive, requires no prep or sedation, and is still effective. The bottom line, after 70 to 75, colonoscopy isn't automatic. Make the choice based on your history and risk, not habit. Finally, full-body CT scans. This is the most concerning on the list. They're marketed as early cancer detection. But in people without symptoms, the risks are huge: high radiation, false alarms, and cascades of invasive follow-ups. National Cancer Institute modeling estimates CT radiation causes thousands of cancers annually. And there's no solid evidence that whole-body scans in healthy people save lives. Marcus, 80, fit and healthy, bought a scan package. It showed a tiny lung nodule. That led to a PET scan, then a biopsy, which caused a collapsed lung and a week in the hospital. The result, the nodule was benign. Experts agree. The American College of Radiology advises against full-body CTs in people without symptoms. If you don't have symptoms, skip the fishing expedition. Imaging should be targeted, not blanket, so what's the smarter path? Always ask, what happens next if this test is positive? Start simple with history, exam, labs, and medication review. Build strength with resistance training, balance, protein, and vitamin D. Choose non-invasive tests first: FIT before colonoscopy, memory screen before MRI. And above all, make it personal. Your values, risks, and history matter more than rigid schedules. If you've stayed with us until now, it shows you're serious about protecting your health intelligently. That's something to be proud of. To keep building on this, we've gathered our best videos into one place: our Elderly Health Mastery playlist. It covers safer routines, brain health, and simple science-backed habits to help you stay independent and strong. Each video adds another piece to the puzzle. Click the playlist right here and continue your journey. Your future self will thank you. This video is educational, not medical advice. Always discuss testing choices with your healthcare provider. Now you'll know the right questions to ask.